Have you ever known someone to die with HIV or AIDS? Have you ever wanted to know how to protect yourself from contracting it yourself? I'm going to explain to you how HIV is transmitted, how to prevent yourself from contracting HIV, and what do you do if you feel like you've been exposed to a risk for getting HIV. I've volunteered at Cali Clinic for over 2 years now, and I'm married to their outreach and prevention specialist, Misty Hughes, who's done testing and classes over HIV for the last 7 years for their clinic. Anyone who has ever been sexually active, tried drugs, or gotten a tattoo could have been at some level of risk for contracting HIV, the human immunodeficiency virus. I'm going to help you learn to take responsibility for your own body and health, educate yourself about the dangers and risks involved with contracting HIV, and how to be proactive if you have put yourself at risk. HIV, the human immunodeficiency virus, attacks the body's immune system and destroys the CD4 cells, which normally help your body fight off infections and diseases, and is shared between people through various bodily fluids. HIV is transmitted through and carried through 4 bodily fluids and can be transmitted during intercourse, drug use, and breastfeeding. Bodily fluids and blood exchanged during intercourse spreads HIV from one person to another. Male seminal fluid and women vaginal secretions are 2 of the bodily fluids that carry HIV. In a journal, it was studied and found that the knowledge about HIV prevention, education, and older adults' sexual activity and implications were lacking in many areas of how educated on HIV the average sexually active adult actually is, according to Altshuler and Katz. Tearing of the vaginal walls or anus during intercourse allows a point of entry into the bloodstream for the virus. Lack of protection and proper lubrication provide perfect conditions for transmission from an infected person to a non-infected person. Drug use heightens your risk percentage for transmission of HIV as well. Sharing needles and syringes between people and not using clean needles or syringes passes the virus directly from one person to another if someone is carrying. Using the same straw or dollar bill also to snort drugs can put you at risk for contracting the virus through a tear or rip inside your nose, where the virus can enter your bloodstream as well. Breast milk is the 4th bodily fluid that contains the HIV virus in people who are positive. If a nursing baby has an ulcer in their stomach, the virus could be absorbed from the breast milk. If there's a lip tear or an open area in their mouth, they can swallow it through the breast milk again and get infected with HIV. Once HIV is transmitted from one person to another through these bodily fluids, it rapidly replicates in the new host CD4 cells. This is what HIV looks like as it attacks your T cells, and it continues to make copies of itself. Now that you know the modes of transmission, let's talk about protection and minimizing risk. Protecting yourself with knowledge and using precautions when you're at risk is the best way to minimize your risk of transmitting the virus. Protecting yourself and others against the spread of HIV by using protection during intercourse, using your own supplies if you're going to participate in drug use, or advising women who are pregnant to take their medication and then formula feed are all preventative measures. Unless in a monogamous relationship where both parties have been tested, always use condoms and lubrication. Condoms prevent the sharing of vaginal and seminal fluids between partners. Results from the meta-analysis taken by Fauner, Armstrong, Kennedy, O'Reilly, and Sweat MDs demonstrated that school-based sex education is an effective strategy for reducing HIV-related risk, and those students who received school-based sex education interventions had significantly greater HIV knowledge, self-efficacy related to refusing sex, condom use, fewer sexual partners, and less initiation of first sex. Ample lubrication assists the condom's viscosity and prevents tears in the condoms and vagina walls as well. Male condoms look like this. Make sure that if you are having sex, that you use one of these protectors to ensure that you don't share any of the bodily fluids. If you're going to get a tattoo or use drugs, make sure that your supplies are sterile and not shared with other people. Making sure any needles that ever stick you are not dirty or used by another person avoids the risk of transmission through blood. Anything to be stuck in your nose that could tear or break the skin should be your own, sterile, and not shared. If a positive woman becomes pregnant, she can prevent transmission to her baby in utero and after birth. In utero, if she's compliant with her medication, the baby has a 98% chance that he or she will be born without the HIV virus carried by their mother. If the woman uses formula afterwards, she then poses no threat to transmitting her virus to her baby via breast milk. You should always be proactive in protecting yourself and to help ensure that others educate themselves as well against transmitting the human immunodeficiency virus. It would be an STI and HIV free world eventually if all people would remember to use protection and not put themselves at risk, but no one's perfect. People make mistakes, live in the moment, and are careless at times. Make sure you're prepared to be proactive with testing and future care if you have put yourself at risk. If and when risk occurs, go get tested. Have future partners tested and or prior to intercourse. And if ever infected, always be compliant with medications, treatments, and appointments. Anytime you go to the bar on a first date, have unplanned sex, most likely are unprotected, go get tested afterwards. The time for seroconversion of HIV is 3 months, so get tested immediately and get tested 3 months again to be sure. If you are sexually active or your partner is with more than just each other, use protection and get retested often. Plan ahead for future visits or outings. Pack an overnight bag with preparations for when you go out. Better than just a prep bag, it would be getting yourself and your partner tested before any risky behavior takes place. Also discussing sexual history between yourself and the other partner. If you do contract HIV, take care of yourself. Be as preventative as possible beforehand, but if for some reason you're not, try to correct or handle what you can as quickly as you can. Knowing your risks, prevention, and treatments helps you always make the most informed decisions you can regarding your health. Now, if you've learned the way HIV is transmitted, how to prevent the transmission, and what to do if you or someone you know is at risk or contracts HIV, do not be the person who dies from lack of education and could have prevented lifelong medications and suffering by being in control of your body. Thank you.